Hey guys, it's Dr. K here. I'm going to do a short little video on circulation of blood through the heart and just show you the kind of simplistic version of how I draw it versus you can look at the kind of complicated pictures in your notes or in your book. But this is a really good technique to use for just understanding the anatomy of the heart and the blood flow through the heart. And it'll really help you answer a lot of questions on an exam. So I just draw a little heart, just like a little Valentine heart. And then I leave the middle open and I draw lines through it, okay? And so now I have kind of a couple different areas set up. And so I'm gonna start to draw my valves, okay? So draw like little waves. And you remember there's 4 chambers of the heart, so there's gonna be 4 valves that are in the heart. Okay, and now you can kind of see we have kind of 4 distinct areas. So that makes this the right atrium, the left atrium, the right ventricle, and the left ventricle, okay? And then because this is between the atrium and the ventricle, this is an AV valve, and this is the other AV valve. So that stands for atrioventricular. Okay, that's what those are. Or the other option is semilunar. So these are the AV valves because they sit between the atrium and the ventricle. And remember, I tell you, you try before you buy. So this is the tricuspid and the bicuspid, okay? And those are the two atrioventricular valves or AV valves. And then the semilunar valves, that's going to be the pulmonary valve and the aortic valve, okay? So that's kind of how the inside of the heart is set up. Okay, now we have to look at how blood enters the heart, okay? So if you're coming from the body, that's where basically all your cells have used up the oxygen that they've been delivered, and so you have to return that deoxygenated blood back into the heart. It comes from the superior vena cava and the inferior vena cava, and this is how it drains into the heart, okay? So that's deoxygenated blood from your body. So it comes back into the heart, and then you think it has to come through the right atrium, and through gravity, it passes through the tricuspid into the right ventricle, and then think it's deoxygenated, so it needs to find oxygen. And where is your oxygen? Well, it's in the lungs. So you pump it through the pulmonary valve. This is going to be the pulmonary trunk, okay? And it's going to go to the lungs. So it was the lungs. It came from the body, and it's going to the lungs via the pulmonary arteries. Okay, remember arteries go away. So I'll write that, lung via artery. Okay. Now, so you've got that side. So you've gone to the lungs. Okay, so in the lungs, you pick up oxygen, right? And so you pick up that oxygen and you need to bring it back to the heart because the heart is going to be able to send the oxygen to all the rest of the body cells that need it now. So you pick up your oxygen and you come in through the pulmonary veins. Okay, so those are going to come into the left atrium. So you travel in, gravity, fly through the bicuspid, and then you're going to pump out the left ventricle to the body. And we pump out the body through the aorta. Okay, the aorta is that big vessel that comes off the top of the heart. Okay, and so you come through, you go out to the rest of the body, remember? And once you send that oxygen to the rest of the body, it uses up the oxygen. It's going to have to travel back to the heart. So you just keep looping. So I'm going to show you, let me get some colors in here. And we'll follow deoxygenated blood, okay? And then we'll follow oxygenated. So deoxygenated blood comes from the body through either the superior vena cava, if you're above the diaphragm. If you're draining anything from the inferior or from below the diaphragm, it's going to come in through the inferior vena cava. This is all deoxygenated, so I'm showing it in blue. So through the right atrium, through the tricuspid, through the right ventricle is going to pump it through the pulmonary valve into the pulmonary trunk, out the pulmonary artery to the lungs, okay? In the lungs, so now pretend we're over here, yeah? In the lungs, you're going to pick up oxygen, okay? So we'll show that in red. Okay, so you've picked up oxygen now, so you need to bring it back to the heart. So you'll go through the pulmonary veins into the left atrium, through the bicuspid into the left ventricle. You'll go pump out through the aortic valve, through the aorta, and you'll go deliver this really nice oxygenated blood to the rest of the body. Now remember, when the rest of the body uses that oxygen, okay, when it takes that really nice oxygenated red blood cells, right, then what happens is now it's deoxygenated again, okay? So then we follow back through and out, right? And then we'll continue this cycle going in and out of the heart. So we'll go lung to the heart, to the body, to the body, to the heart, to the lung to the heart, to the body, the heart, to the lung. And you can see how you could just keep flowing through this over and over and over again. And the reason you keep doing that, right, is so you're always delivering oxygen to the cells of the body. And then you're always delivering that blood back to the heart so it can get to the lungs to pick up new oxygen. So I hope that helps. I hope that makes it a little bit clearer. I know my handwriting's not the best, but hopefully just kind of walking you through these steps is helpful.